Just put it in record mode so that it can record. Yeah, it is recording. No issues. Please continue. Sorry.
Good morning, everybody. Today, the topic of mine is telehealth. So, as we all know, telehealth is the use of telecommunication and information technology. And today's world, it's helping every people to do the health assessment, diagnosis, intervention, consultation, supervision, and whatnot from the distance. We can do everything. So, as a nurse practitioner, I know in this pandemic, I was also new to the telehealth, but we started nobody knows where the world is going, and everything is in lockdown, but patients are in need and they have chronic diseases. So initially they tried connecting patients with telephones, because patients do not have access to the videos and they don't know what to do, because everybody is in a learning process. And we started like that. We were doing telephone visits initially, and then slowly the my chat access mean my chat is like a link that is connected to their electronic records, so they may receive a SMS, and by that link we can connect to the charts. And then through that link, the patients, when they have a smartphone, they can download the Zoom app. So Zoom telemedicine is introduced to patients, so we are able to monitor the patients in a remotely. And and we are able to connect patients, monitor the data, and we can interpret. What does it mean by monitoring and interpretation of data? Say, for example, a patient is having a high blood sugar, and that's a chronic patient. So, usually the patient comes to the clinic, the nurse assesses the HbA1c and interprets the data, and then the doctor or the physician or the provider give the medicines. But now everything is in lockdown, and patient cannot come to the clinic, they cannot see face to face. But the technology has improved a lot, and now the patient can do their I'm giving a simple example, but advanced things can be done. The patient monitors their blood pressure or their blood sugar, tells the data to the nurse, the doctor. They can systematically adjust the medicine, titrate the insulin as needed, or tweak or change the blood pressure medicines, and then the patient gets healthier, or the healthcare is provided in such a way. So what is the need? What is the importance? Why everybody are telling telemedicine? Telemedicine is a cost effective. It's not a new thing. It's not a fancier thing. Even in Apollo, when I was a student, Dr. Pratap C. Reddy introduced telemedicine those days. Like, if I remember, many years ago, they were satellite centers. So what they would do is, they get the doctor's consultation. Example, if the doctor is in Hyderabad or America or UK, they connect they show the results. Say, for example, it may be X-ray, or it may be a cardiac procedure. They may get an expert advice, and then they can advise these doctors how to proceed, and they do it. So it's from beginning, it's from those days. But now it's a touch of button, so patients can get an access, because we have smartphones. And so now we are enabled to do face-to-face consultations. And the provider, so I'm a provider in US. What is a provider here? MDs. MD means medical doctors. DO means doctor of osteopathy. They are doctors. And nurse practitioners are mid-level providers, and physician assistants too. So we are called mid-level providers, but we do diagnose. Um, we do diagnose and do all kinds of things what doctors do. And we monitor the patients, we do medicines, like we do prescriptions. So, say, for example, here how the MBBS doctor work in India, we do the same work, but we can do advanced things too. Some nurse practitioners can do, if they're trained, they do Botox. They can do in ICU, they do PIC lines, they do art lines. They can intubate, depending upon the specialty. There are various specialty in US. If you want to be if you want to work in if you want to work in the anesthesia room, you have to be trained as a CRNA, certified registered nurse anesthetist. So things can be done there too. So somebody, I can hear somebody's voice. Excuse me. Please mute yourself, please. So as I was telling all these things, telemedicine is a two-way interactive audio-video communications, and we have use of computers. Telemetry. What is telemetry? So here in US, so if there are 5 patients assigned to a nurse, they have a cardiac monitor, and the monitor is connected to a centralized monitoring room where a technician sit. So the technicians sit and they monitor their heart rhythms like that. They monitor their heart rhythms, and if anything happens, if, say for example, if it's a cardiology ward and there is a technician, it's not the nurse who sits there, it's a trained technician who sits there. And if the patient is going for ATAC, means VTAC, every nurse has a cell phone, cell phone kind of phone connected to them. They give an immediate thing, so the nurse go and assess and do emergency procedures like initiate the take the crash cart and do all the code blue stuff. Every hospitals has a different name, but they do those things. So that's telemetry, and that's how remote patient care, they're able to deliver health services to remote patients. And also we can exchange information between the. So what is primary care physician? Say for example, he's the primary doctor. Here it's like one doctor. So in India, we go for, so like that, we can go to a ortho doctor. Like that, we can go and see a not the primary doctor, like a heart doctor. But here, everybody needs to come from a central doctor, like an internal medicine person. So everybody gets a referral. So the primary knows everything about the patient, and that's how they connect to the specialist. So everything is monitored in a holistic manner. So this kind of telemedicine connects the patient, primary care provider, and specialized person, the specialist. That even though the specialists are sitting at a distance, we can connect with each other. What are the uses of telehealth? It is, give me a minute, just a minute. Somebody is talking. All right. Okay. So let me see. So what is the uses of telehealth? As I told you, it is a central thing to connect patient and providers, and the patients are able to connect to the providers, and they do not need to travel a very long distance. Say for example, in US, things are in clusters. So whatever you see, in fancier television or TV or cinemas, everything is not fancy up here. Everything is not fancy at all. Uh, uh, Places like Chicago or New Jersey or California or Texas may have people who are densely located, but most of the things are rural areas where patients don't have an access to the healthcare. They don't get the specialty care that they need. So telemedicine is a boon that connects patients to two different ends. So the doctor, if say for example, if the patient has a stroke, if the patient has a stroke, they can connect the patient to the stroke specialist, and then they can get the guidance, and they can do the care as needed. I will explain a little bit more in the further slides regarding the same. Let's see. What are the other things? We are able to give a patient-centered care. What is patient-centered care? Patient-centered care is something respectful, respecting the decision-making of the individual patient. So it's not like we enforcing what the patient and the family needs to do. So we need to do a meaningful, valuable thing to the patient, so the patient think that he is at the center. So at the end of the day, he needs to go. He needs to have a self-care management. He needs to do whatever he wants to do. If we are telling, he may be listening to you for 3 days, and what happens? He steps out of the door. he just say bye bye, tata, bye bye, and he doesn't just care. So he needs to be concentrated, and he needs to have a clinical. He needs to be given the he needs to understand what is the healthcare need, what and so the healthcare management is better in the hand of the patient, and then he understands what to do, and then he does everything for himself. So clinical decision making thing needs to come from the patient. It's not like the patient say what to do, but we need to make sure the patient understand what is good for him, and then he goes for the self-care and self-management practices. And telehealth during this COVID-19, as we all know, if we take the patients, so imagine everybody coming to the hospital. What happens? We don't have enough PPE, personal protective equipments. There's a surge of patients coming in, and the staff are exposed. What happens if there is a 10 staff and the 100 patients are coming? 10 staffs are sick. Who is going to care for those next 100 patients and the next 1,000 patients? So we need to have a system so they are not exposed. And we need to have it, and this is helping in triage and where the in-person services are not needed. So say, for example, we can ask the symptoms. Oh, do you have a headache? Do you have nausea? Do you have vomiting? How many days you're having a fever? Things can be done through a telephone. We don't need to even see the patient. Some areas we need to see the patient, but we don't need to see the patient all the time. So these things can be done through that, and it helps in minimizing the transmission of the virus from one person to another. And before the pandemic hits, everybody are kind of said, yeah, we will go through that. But recent policy changes reduce the barriers. It is all in a one day. Where, when President Trump signed the initiative, it went in a single day. Everybody said, oh, we are going to Zoom, but it was not a practice before when this all happened, but it happened. And medical societies. Medical Somebody is on unmute. Please mute. And we hear some noises. Please mute yourself. Thank you. Many professional societies are agreeing to it, and it is able to do a patient improve the patient health outcomes. The benefits of telehealth. So as I said, it increases the social distancing, that we can have a continuity of care, preventive, chronic, we can do routine cares, and then people who are vulnerable people are able to access healthcare, and we are able to preserve the patient provider relationship. There is no conflicts there. Where are the areas? As I told, we are incorporating telehealth in the areas of screening. We are able to do in a chronic disease management. We are able to do chronic health condition, medication management, weight management, nutritional counseling. We are including them in physical therapy, occupation therapy. We are able to do, as I told you, the same blood pressure, blood sugar story. We are able to assess them from a distance, able to give them, assign them a case manager. Here, case managers are assigned for chronic patients like COPDs, congestive heart failure. So they monitor them. The reason behind this is reduction of healthcare cost. So the patients are not admitted. So say, for example, the patient is huffing and puffing with CHF exacerbation. So all he needs is simple protocol. The case manager can help them what to do next, and then if they really need to go to the emergency care, they can go. It's a huge bill if you go to the ER, or they can go to an urgent care, or they can wait with the symptoms, go to the PCP. They can be done by the primary nurse or the case manager nurse. And we can do a follow-up of the patients after they get discharged, and then we can do advanced care planning. And we have a lot of nursing homes here, and telehealth is a boon to care of the patients who live there. And telehealth is also a good resource to train peer-to-peer consults, and the peer-to-peer education can be given, are possible. It's not can be given, it's possible through telehealth. And regarding patient perspectives. What is patient perspectives? That mean, what do the patient think? So there was a study finding by Leroy et al. In 2015. What do they say? So focus group is a qualitative type of study. They assess the patient's perspectives, and the findings reveal the medical providers need to focus on patient care rather than technologies. Don't It was a finding out of that, but it also emphasized that telemedicine needs a good management planning. Example, if the doctor sits in the room, and the patient is up there, they have to have a, so initially the same case scenario, what happened to my first computer, nothing was visible because my dad poured water on the computer like 2 days ago, and my husband was using a thing to dry it out. It's a different story, my sad story, my all these things in that computer, PhD things. I'm scared it should not crash. It won't crash, but it crashed the screen of the, what is that, light? I forgot, I'm blinking on that word, this thing. So it gone. So that's the reason I switched the computer. And room design, lighting, privacy. These are things, and on building management, the style of communication. What sometimes there is, if it's if we have a lot of patients who don't speak English here, Bosnians. We have Vietnamese patients, Bosnians. What else? People from Arabic, and they don't speak English. Sometimes we can just they have always have interpreters, but body language we can communicate. But if the person is sitting at the other end and you are at the other end, imagine there is no video, you're on telephone, nothing can be done. So style of communication, I'm just giving an example out of it. And implications for telemedicine practice. As we all know, for anything, people need to be trained, and then we need to have advanced planning sessions. Everybody needs to have common protocols. Everybody needs to use the same language of what is going on in the process. That means a common framework. Framework means what to do now, what to do now. If there's a troubleshooting, what to do now. So kind of things. So telehealth is an emerging field, and nurses have a very good, hands-on on telehealth. We have a lot of positions up here. They do telephonic nurses, telephonic nurse consultants, case managers are there. These are people who have been employed by the insurance companies. So what do they do is, when I was pregnant, I had a case manager, I believe it's the case manager for my OBGYN. She was calling me so and so weeks and make sure I do this, I do that, and I eat okay, and I go for this test, and she follows me up to make sure. Why do they do? What is the need for the insurance company to have telehealth nurses? The thing is, they don't want to add a big chunk of money to their insurance, right? If the person is not well, they ultimately the insurance has to pay for that. So it's always good and safe. They have a nurse who monitors it, the health condition of the patient, so they don't need additional health services. So that's the reason. And then we have a lot of nurses are using telephonic thing and telehealth thing, telemedicine thing in doctors' offices, hospitals, health plans, as I told you, and many multiple health corporations are using it, and nurses are fortunate to work remotely from homes. I was working for some period from home. I was, that's a good thing out of this COVID. We can do telemedicine. That's a good thing. And telehealth nursing. Say for example, see, a child is not well, and you are a parent, and your child got sick at the night time. And if you go to the ER, it's a big chunk of money, but it's not, we cannot say it's a child and we need to go. But if there is a nurse on call, and if you call them and if you say the signs and symptoms, these are the signs and symptoms the patient is having, the child is having, she has a protocol, right? And she will go over things with you and make sure whether the patient is, in a serious condition that they needs to go. There are only 18 beds in a ER. What happens if 80,000 people are going there? They got stuck, right? So it's a triage thing, and the nurse can do who is needed up there and who don't need, and who needs a reassurance. It can be a simple fever, or it can be a episode where it can be resolved by reassurance. These things can be done. And a study also done where the nurses, the parents said the receiving nurses advice over the telephone helped them to have support, encouragement, confident, and in caring their sick children. And similarly, this can be applied to COVID, the CHF, COPD, you name it, you can do it. So it's an endless possibility. Telehealth, the nursing process. What did I do here? It's all zigzag. Okay. So you need to have when you are asking a teleconsult with the patient, you need to make sure you're questioning, and you need to get their perfect or the needed information. You need to have a symptomatic the review of the patient condition, what the patient is going through, if there is anything urgent, what is the level of care, if it's urgent care, or if it's the emergency care, or it's ICU care. If the patient is unconscious, ultimately he's going to end up in an ICU. But you need to make sure that you are trained to, as you see patients, you get confident. Even when I'm going to the first day of pediatric ICU, I was dumbstruck. I don't know what's going on. Everything is blinking. Everything. I got a heart attack. But 20 years, what should I know? I don't know anything. But as years go by, as Bernard tells you, you know the novice nurse becomes advanced learner becomes expert nurse, and things go on like that. So as you starting, even we were doing nail care, but today I'm a provider, but there is a baby step to everything. So it doesn't mean you're going to do nail care for the end of your life. That doesn't mean like that. You need to go step by step. That's a nursing process. So ultimately you'll reach whatever you want to reach. So you need to know the steps and the clinical reasoning, how to manage a patient. You have to have a wise clinical decision making. So whatever your teachers teach, that's what they make you to reason. So it doesn't mean when your instructor is coming behind you and asking, well, did you do this, did you do that? Because as students, we don't know. When we are students, we don't know what is the reason behind everything. We don't have a judgment. But to those teachers, they have several years of experience, and they know what is expected, and that's why they are behind you and teaching you. So that's a good thing. We are also felt the same thing years ago, but now we know why they were behind us and telling things what is needed. So coming to the telephone triage, the same thing, but it's given in a mnemonic thing, a scholar. So telephonic triage should include symptoms. What is the example? If the child is sick, you should ask, what are the symptoms? What if the child is vomiting? What is the characteristics of vomit? A history of the child. Does this child has any medical history or any birth history or anything like that? Is the symptoms like sudden? What is the duration? Where is it paining in the abdomen, location? What are the factors that aggravating? The mother may say, even if I give some water, thanni kudicha vaandi vandi edukra. So everything, everything has a different, when you things associated with it. And what are the relieving factors? Some says, oh, if I sleep like this, it gets relief. If I sit like that, if I walk down, I get a leg pain. If I walk up, I feel better. So everything has a thing associated with it. If you learn things, what is behind, if you learn the pathophysiology in the right way, you are learning in the right way. But if you associate things, it comes in a sequence, and you will be able to do the care which is essential to the patient. And more than just a phone call, So, oh, what is this telenursing, telehealth, phone? Who takes a phone care? I don't, I don't believe this, but it doesn't mean like that. So, as nurses, we are the resources. We know a lot, but we need to make sure the patient gets that information, and the families becomes they get what do you say, the good word. So they trust you. So the health education which you give, they need to trust you. That's the communication skill you need. You need to get trained the way every. So you nurse, when you become nurses, you will not sit in Madurai, or you won't sit in one place. You will be gone in places to, many countries, any country, you name it, you can go. Whatever, it's a will. Whatever you want to do, you will reach it and you will go there. So you need to be trained. You will learn those languages. So it's a communication skill what you are going to gain and how you are trained. And experienced nurses can take various roles, and they can provide health and safety to the patients using a variety of technologies up here. So I thank sincerely Dr. Helen ma'am for giving me this excellent opportunity, and I'm happy to see all your faces when you're saying namaste. That's it took me for many years ago. So yeah, this is one of the diagram my daughter made. She just turned 9 years old. அவ பேர் அக்ஷயா. அவளோட டயக்ராம் இது. அவர் ஆர்ட் கிளாஸ் போனா, அது கத்துக்கிட்டா, அதனால அதை நான் போட்டிருக்கேன். So yeah, this is one of my diagram by my. I have two children. I have another kid. Her name is Anushya. She just born last year. So the lockdown birthday வந்துச்சு மார்ச்ல. So yeah. Let me find Dr. Helen ma'am and make her, I'm sorry, I unmuted everything. Let me see.
Yeah, thank you, Karpagam. I have unmuted myself.
Okay, ma'am. Okay, ma'am.
Karpagam, thank you. Thanks a lot. And I think it's an excellent presentation. And it's really an eye opener, because all our students are basic BSc students, so they miss a lot of opportunities. And sitting in Madurai, I think they may not get a lot of chances to attending such type of webinars. That is one motivation where I wanted to make them understand that there are lot of opportunities are there, and it is our responsibility to understand the opportunity and grab the opportunity wherever it's possible. So it's an eye
Yes,
opener
ma'am.
for our students, that it is nice to be connected with our teachers, to share our experience through such portal uh, with the students. And another important thing, and even sometimes students might think that attending phone call is not necessarily, it's they have to learn. But basic mannerism of attending a phone call, which will bring them to a very big level of understanding, and it is not at all there included in the curriculum. So that is the reason I have taken this particular topic, focusing on BSc curriculum as such. And you have also emphasized how the nurse move from basic level nursing to advanced level nursing. And you also showed how important that what is an important role of a nurse as a health provider when they go abroad, when they move abroad. Like, because we always sit in India and we study here in India, so our focus as a nursing student or as a nurse, we always underestimate us. But it's not like that. I remember how Karpagam was when she was a student. She's a very smart student, but at the same time, I could understand the difference of learning experience, what the ladder, what she has come across, and how she has utilized all the opportunities. So it is a very good chance for our students to understand all these things. And thank you very much, Karpakam, for your extensive explanation of how the telehealth is done in US. As I said before, it's not there in US in undergraduate curriculum of our BSc nursing students. So this presentation will give them a very wide overview of how telehealth is important. Though it's not there in the curriculum, it's essential for them to understand how there are different levels of opportunities are there, and how it is useful during crisis. So thank you very much, Karpagam. motivate our students that the opportunities are huge, and it is the responsibility to equip themselves every day as they enter into nursing. And I think it is midnight in the US. So with all such after a heavy work duty hours of daytime, they have spend time with us to make you all understand that how what are all the opportunities, how people will who have studied here have gone up somewhere and they have improved so much. So, and I also extend my acknowledgement to Vani, who is also listening to this webinar, who is one of my friend in US, and all other well-wishers, students, senior faculty from Apollo College of Nursing and all other institutions from India and abroad who's attending this webinar. Thank you very much for all your cooperation. And I think again, we'll meet you again on Friday at the same time with another topic and another expert. Thank you one and all. Thank you, Karpagam. I think you can go to sleep now.
Thank you. Thank you.
I would like to add one more
Vani
thing.
and
என்னோட
Karpagam, thank you.
என்னோட இன்னொரு மேடம், அவங்க வாணி மேம். அவங்க வந்து என்னோட எனக்கு எப்படி ஹெலன் மேமோ அப்படிதான் எனக்கு என்னோட இங்க யுஎஸ் பாஸ்டனுக்கு எனக்கு ரெஃபர் பண்ணதே அவங்க தான். அவங்க ஷீ இஸ் ஆல்சோ மை டீச்சர். ஷீ இஸ் அட் பிரசன்ட் இன் அட்லாண்டா, யுஎஸ். ஷீ இஸ் ஆல்சோ கோயிங் டு பிரசன்ட். ஷீ இஸ் ஆல்சோ கோயிங் டு பி ஒன் ஆஃப் த presentators for you. I'm sorry. And yeah, yes ma'am, Vani ma'am.
Yeah, excellent presentation, Karpagam. Very nice to hear from you. Yeah. And I would like to add one more point when we talk about the telehealth, and even before the COVID situation and earlier, even when you have a trauma, like, when we have a trauma center, if somebody works in trauma center, and then for a small example, I would like to give regarding the telehealth. When patient met with an accident in the road, and then the ambulance is going and taking the patient in the road, and when they are taking, here in US, when they have a trauma center in the hospital, from the trauma center the ambulance is going to pick up the patient, and then when they are picking the patient in the road itself, in the ambulance they do have a CT scan facilities and everything in the ambulance. And then as soon as they pick the patient, and they does everything to the patient. So the doctors in the ER, and they can see what they are doing in the ambulance. Yeah, before even patient is reaching to the hospital, they keep this theater ready, everything ready, what is going on with the patient, especially with all these trauma centers. They can see whatever is going on in the ambulance, they can view from the hospital. That's one of the important view of the telehealth. Even before COVID, it was going on in US actually. So they can save the life of the patients. So immediately you couldn't even imagine the patient is in the road, they are coming on the way in the ambulance, and they are doing the CT scan in the ambulance, and they are getting a report before the patient reaching the hospital. The doctors and then all the experts can review the reports in the hospital, and then they can bring the patient to the theater, and then they can save the life of the patient. That's one of the main thing, very advantage in doing this telehealth.
I think in Telangana, they have introduced such type of ambulance around after this COVID. I think last month, they have introduced around 2,500 ambulance in Telangana state, all throughout the state, reaching with all such facilities. How in US, they have introduced an ambulance for rural people, especially. That is one advantage after this COVID. Telangana has taken up the initiative. Thank you, Vani, for your contribution. And thank you very much for all the students and everybody. I think we will sign off and we will meet again on Friday. Thank you, Karpagam,
Thank you ma'am. Thank you.
and
Thank you,
convey my
Helen and
regards
Karpagam.
and gratitude for your husband, especially because he only helped us.
Thank you.
Thank you very much,
Thank you.
Karpagam. Go to sleep. Yeah, thank you all of you all. Shall I sign out?
Yes ma'am. And it will stop the recording by itself, ma'am, if we end it.
Yeah. I'll stop it. I'll stop it.
Okay.
Thank you, Karpagam. Bye. I'll message you later. Okay.
Oh, thank you, ma'am. If any opportunities come up, please do let me know. I'm happy to help you out.
Sure,
And thank you.
100%. Once even after students come, I'll be able to arrange here because we have all these facilities here.
Sure,
I can do it, Karpagam. Thank you.
Thank you.
Bye
Thank you,
then.
Vani
Bye.
ma'am.
Yeah.
Thank
Thank
you.
you. Thank you. Yeah. Thank you all.
Thank you, Vani. Bye, Vani.
Thank you, Helen.
Thank you.
Yeah, bye.
Thank
Yeah,
you.
thank you all. You all have a wonderful day.
Yeah, thank you. Same to you.
Thank you.